Now, on the vaccination strategy, well, indeed, at an early stage, we discussed this with member states, and vaccination strategies means that you have to set priorities. Merely the fact that right from the beginning we said that according to recommendations we'd had from experts from the health sector and the WHO, we were recommending that the priority in the vaccination strategy should be the health staff, people over 65 and the vulnerable. You're aware of that. This shows that it was quite clear from the beginning it's not possible to vaccinate everybody all at one go. This will have to be done step by step. And what we've also constantly emphasised and what is being demonstrated now is that we're going to have difficult months in the spring because we have two trends. We have the slow increase in the number of vaccinations, the increase in the number of people who have actually been vaccinated, but that's going to be a slow process. And secondly, the fact that what's happening with the level of infection is something that's still a matter of great concern. That's exactly the point that we're at now. And therefore, I'm convinced that when we look back at this one day, we'll see, well, yes, at the beginning, there was a bumpy road. Well, that's always the case with these major changes that we're having to tackle. But I think when we look back, I'm convinced that we'll recognise that a lot has been done in member states to get the vaccinations up and running. And secondly, once again, all decisions on purchases are taken and have been taken together with member states. And from BioNtech, Pfizer, from CureVac, Moderna, Johnson & Johnson, AstraZeneca, and so on, we need a combination of what's actually supplied, but also timeliness in terms of delivery. That's important, which I'm sure you can understand. We don't want to find us in the fourth quarter of the year where the supply comes on stream later on in 2021. We need this now when we need the vaccines. So we have a happy coincidence now in BioNtech Pfizer. They've been able to extend their manufacturing of the vaccine, and we've been able to strike a contract in order to increase the number of doses.